Good Wednesday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to our new team members that have come on board to assist our response. We are also thankful for those in our organization who have stepped up and are serving in a capacity that is new to them. Your assistance is so valuable to us and the community. As a reminder, the Board of Health meets tonight via Zoom at 5 p.m. The public may watch the meeting live on Knox County's YouTube page or the Knox County website. Now we'll move into the local situation. We have 3,533 confirmed cases of COVID-19 in Knox County. Additionally, we have 148 probable cases. 1,539 of our cases have recovered, giving us 1,967 active cases. 186 individuals have been hospitalized at some point in their illness, and 38 Knox County residents are currently hospitalized. We are saddened to report that we have an additional death due to complications from COVID-19, bringing our total to 27. We do want to clarify that this death was reported to us over the weekend. Of the deaths reported to us over the weekend, we lost a 73-year-old woman and an 80-year-old man. Our thoughts and prayers go out to the family and friends of these individuals. Now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see, are things getting better, staying the same, or are they getting worse? And if so, how much better or worse, and at what rate? We will now pull up the data, and as a reminder, all of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. We have seen consecutive days of red flags and a significant continuous increase in the volume of new cases. This causes us to represent this traffic light as red. This is a concerning trend and further reiterates that the virus is still very present in Knox County and increasing at a high rate. This is why we continue to reinforce the critical importance of following the 5 core actions. Now that it's been almost a month, we have seen a lot of questions about the effectiveness of the mask order. We hope to start seeing an effect from it soon. However, it is important to know that for this order to work, everyone must participate. And we don't mean just wearing a mask when you're running errands to the grocery store. You should be wearing a mask anytime you are in a public place, or even when you're at home hanging out with friends and families who do not live in your household, when at least 6 feet of physical distancing can't be maintained. For this order to have an effect, we all need to practice the 5 core actions all of the time, not just some of the time. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of the test conducted for Knox County residents and another for average time between specimen collection and lab report data. From the data we can see, the trends are heading in the right direction. The number of tests conducted continues to trend up, and the lag time in our community has gone down. We are encouraged by this. However, we are keeping this benchmark yellow because of the continued lack of stability with lab capacity that we've been talking about for several weeks. As we mentioned earlier this week, we are working with a new vendor from our own internal testing, and are already seeing improvements and getting results much quicker. This is encouraging, and we will continue to watch it closely. Now on to our third benchmark, sustained or increased public health capability. For this benchmark, we aim to reach out to cases within 24 hours and close contacts within 48 hours. To date, throughout this pandemic, we have accomplished that for all of our cases and contacts. Because of that, this benchmark continues to be represented as green. As we mentioned last week, with the volume of active cases increasing, this goal is getting harder to reach. We continue to build out our contact tracing capacity to be able to respond to the growing caseload. You'll notice our team grew by 39 people from this time last week. That comes as a result of cross-training more of our team members so they are well equipped to jump into the EPI support team as needed, as well as bring in additional people to support this team, including volunteers and temporary staff. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. For this benchmark, the traffic light is yellow. We did experience days of statistically significant increases regarding positive patients and ICU patients, but not ventilated patients. After speaking with our hospital partners, they stated this benchmark should be represented as yellow. As Dr. Shamia mentioned in last week's Board of Health meeting, the hospital systems continue to meet daily, assess the situation, and plan their response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. And our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by their date of death. This benchmark is represented as red because we have seen statistically significant increase of deaths over the past 14 days. As always, our prayers are with the family and the friends who lost loved ones. And I'll now open it up for questions.
All right, as a reminder, go ahead and submit your questions into the chat feature. All right, any questions? Okay. First question from Paul with WBIR. When we started reopening, you mentioned that cases would rise and then hopefully plateau. We haven't really seen a plateau, but would a plateau over 100 new cases a day be sustainable?
We have not seen that plateau. I think that as long as the hospitals could maintain taking care of the patients that end up needing to be hospitalized out of that volume, and we could continue to contact trace for that volume, then it could be, but it's never a good thing. I mean, we want to see it plateau and then ideally come back down. And that's where we come back to that core message that we need everybody following all the prevention methods all the time. We're seeing so many people, and I'm talking to cases where it's the people you're feeling comfortable with, the people you're working with every day, your friends that are coming over for the barbecue, the birthday parties, the sporting events. Those are the places where we're seeing people letting their guard down, and we're seeing transmission spread there. So we really want to, again, encourage people to follow those actions wherever you are.
Also from Paul with WBIR, can you speak to the importance of vaccines this fall?
Oh, it's going to be tremendously important. It always is from the public health perspective. And we really want to encourage, the kids that are going back to school to continue to get their vaccines that they need for that. And even if they're not going to school, if they're younger, to make sure you're staying up with the vaccines. We don't want to add other disease outbreaks to the fall when we would have, when we're going to have COVID cases as well. And the same thing goes for influenza. Again, we want to do everything that we can to lower the disease burden so our hospitals and healthcare systems can continue to support the need across the board. So vaccines are extremely important and continue to be even more so this fall.
From David with WBLT, what is KCHD's thoughts on Dr. Burke's call for more limits for Tennessee statewide?
We completely have been talking about the 5 core actions and staying home when you're sick and following all of those as much as possible. And we support all the recommendations that go along with that, most definitely. As far as closing things and the recommendations that came from her on that, that'll be something that will be up to the Board of Health, and that'll be discussed later this evening.
From Paul with WBIR, looking at current hospitalizations, they're rising pretty steadily in the East Tennessee region, but Knox County seems to be more stabilized. Is there any reason for that? And are you concerned about surrounding areas?
The case counts are also rising in the surrounding counties. And so it kind of makes sense that we're seeing at a rate higher than ours even. And so it makes sense that there would be more hospitalizations coming out of that, as we've explained before. And it is absolutely concerning because we know that all of our hospitals are impacted by not just Knox County, but the entire region. Again, goes back to doing everything that we can as a community to really buy in and be willing to change our behavior, which is a hard thing to do and we're tired of it. But change our behavior for the next few months to really be able to help us make an impact here and see some change.
Also from Paul with WBIR, he says, looking again at the hospital capacity benchmark, it appears total used and unused bed numbers have either stayed constant or dropped, but available ones have gone up despite more COVID hospitalizations. Are hospitals scaling back on elective procedures, and is there an explanation for that?
Hospitals are working together, like we said, every day, and I can't go into the details of their plan. We'll hopefully be able to get a hospital rep back here very soon to talk to you all. Or you can reach out to them directly. But I know that there are a lot of moving parts as far as opening different areas to accommodate surge patients from COVID and a myriad of things they're doing to maintain their capacity. And this is something, again, they're very good at doing. They do it every year during the fall, during flu season. And it's something that's a normal occurrence for them to be able to figure out ways to juggle their capacity to grow where the need is at that time.
From Vincent with the Sentinel, the past month has been the worst month locally for the pandemic. Do you anticipate that August will be similar given what you have seen with respect to reopening, mask wearing, et cetera?
The trend has not started to go back down or even level off right now. So we are concerned about that, absolutely. And that's why you keep hearing us give the same messages. It's really coming down to we need the buy-in of the community in all areas and all levels. But given the rate of increase that we're seeing, it is concerning as we move into the next month.
The next question we have is from Paul with WBIR. He says, how would you grade Knox County residents overall with response to COVID right now, A through F?
That's a hard one. When I go out and have to go to the grocery store or something of that nature, I'm really very impressed with what I'm seeing as far as mask wearing and adherence to the guidelines. I think that people are doing a great job there, and we encourage you to continue to do it. The issue that we're running into, and I really do think it's people are just are feeling comfortable with certain people that they're around a lot, or they're non-household family contacts or their coworkers. It's that letting the guard down of those people that we're feeling comfortable with and not practicing all the guidelines there. We're not keeping at the sporting events or at the barbecue. We're not keeping our 6 feet of distance always. We're not wearing masks always because we feel comfortable. And that's where we really want to get the message across to that we could improve our actions to make more of an impact at this time.
Also from Paul with WBIR, early indications show Nashville's 14-day new case rolling average has stabilized and is no longer increasing. The rate of transmission has declined slightly. Does that give you hope that Knox County will start to see that soon as well?
I do. I looked at that actually yesterday, and it's encouraging. And I saw that they're cautiously optimistic. And so I think that what you see is when there gets to be more buy-in, then you start to see an impact. And so hopefully we'll get there soon. We need to get there soon.
From David with WBLT, does Kchd have a number of false positives test, and is that number taken out of the total?
False positives are really a hard thing to talk about. So if you have a positive test and a negative test by Department of Health guidelines from Tennessee Department of Health, we treat that as a positive no matter what. So we do not take that out of the counts because there's no way to know if the positive's right or the negative is right at that point in time. So all of ours are counted as a case. And we investigate them, we isolate, we do contact tracing, all of that as it's a case. regardless of whether there was an immediate negative test following that.
Also from David with WBLT, with Knox County schools getting ready to start, have many KCS teachers tested positive?
Well, we don't speak about individual cases or clusters at this time. But again, there's positive cases happening throughout this community in all kinds of workplaces. So again, encouraging everybody to do everything they can to limit the transmission so we don't continue to see that.
From Vincent with the Sentinel, you mentioned community buy-in, but there's a limit to how much each individual can affect the overall pandemic response. How would you rate the policy response at the state and local level?
Making sure I understand. So, you know, I can't really speak about the policies that are being made at the state level, and the Board of Health can talk about our local policies tonight and tomorrow. It's hard to make, we can't policy our way out of what people are doing in their backyards and with their friends and families and birthday parties as much as, you know, we would like. We can't regulate our way out of that. And so that's why we really want to talk about community buy-in of individuals. And I would disagree. I think if everybody has the buy-in, I think the individuals can make a difference and have an impact there. And that's what we want to see.
Any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in. Thank you all for your time. Oh, I'm sorry. I see one more question. Alan from inside of Knoxville. If a school staff member tests positive, should everyone in direct contact with that person quarantine for 14 days? Isn't that what the CDC guideline says?
So yeah, so what the plan will be is if we have a school member test positive, staff member, student, or anybody, just like with anybody else that tests positive, they'll interviewed and we'll do our investigation, and everybody that was within 6 feet for more than 10 minutes of that person will be asked to quarantine for 14 days.
All right, just making sure. Any other questions? All right, not seeing any other questions come in. Thank you all for your time, and we will see you on Friday. Have a good rest of your day.